So why do we call AUMY the next generation dental platform? Because we don't believe the next generation of dental software should simply help dentists enter data and manage their clinic. It should actually work alongside the dentist. So let me show you a very simple example. I'm the dentist. I've opened today's encounter. And instead of typing everything into the system, I simply turn on the ambient recording. And now see the magic. Patient came with a complaint of severe toothache, lower right side, worse at night. We took an IOPA of tooth 46. X-ray showed deep caries reaching the root. Started root canal on 46 today. Access opening and pulp extirpation done. Advise aceclofenac paracetamol twice daily for 3 days. Second sitting after 2 days. And guys, so even if while you're having the conversation with the patient, AUMY works in the background. See here, it is extracting all the clinical facts. It understands clinical conversations and it turns it into a structured documentation. See here. So this is the SOAP note. Okay. So AUMY has documented everything. Subjective. Patient presents with a chief complaint of severe toothache on the lower right side, worse at night, no allergies reported. Vitals not recorded. Radiographic findings. Intraoral periapsial X-ray of tooth number 46. Lower right first molar reveals deep caries extending to the root. Clinical findings. Deep caries lesion on tooth 46, consistent with pulpal involvement, nocturnal pain, pattern indicative of irreversible pulpitis. Assessment. Dental caries extending into pulp tooth 46, also documented the correct ICD codes. Deep caries reaching the root confirmed on IOPA radiograph. Primary diagnosis. Plan. Procedural performed. Root canal treatment, RCT sitting. Access opening and pulp extirpation completed on tooth 46 today. Medications prescribed. Aceclofenac 100 mg. Okay, so instead of doing this, I'm going to save this now, and you can even attach the attachment. So I'm going to save this and see what happens. Okay, now here guys, if you see the dental chart, it says teeth 46, root canal treatment, RCT, sitting 1, access opening and pulp exploitation. So everything has been documented automatically by AUMY. Doctor hasn't even touched anything. Okay, vitals, because we did not document any vitals, so no vitals. Diagnosis, dental caries extending into pulp and pulpitis. So these are all the ICD codes, International Classification of Diseases code. Allergies, no allergies reported. Medications, paracetamol, aceclofenac paracetamol twice daily oral, take 1 tablet twice daily for 3 days for dental pain relief. All the notes documented here. Documentation, you can attach anything, any x-ray, and in fact it will also document the notes for x-ray for you. Also, if you want to provide this patient with their entire medical history with you, you can just go to the patient's chart. All the history is recorded here. You can just click on record PDF. It will generate a branded PDF with your clinic logo, and this is how patient's entire history, medications, diagnosis, whatever procedures you have done, the visit timeline, and all the documentation on the file, everything can be shared with the patient. So you don't have to stop and type everything manually. The conversation becomes the clinical record. Less administrative work, more consistent documentation, and more time for what actually matters. That is taking care of the patients. And guys, this is just one part of what makes AUMY different. AUMY is designed around the entire patient journey. So let me show you what other capabilities AUMY has, which I will show you in detail in our next demo video. So from converting the first inquiry to caring for the patients after treatment, dormant reactivation, it's reactivating patients who have gone inactive. And all of this, guys, ultimately helping the practice grow. I am very excited for the future of dentistry. Are you ready?